Welcome to Policy Connecting Communities. I'm Abdulkadir, your host. Our podcast exists to create a space for state and local community members to come together and give voice to the real-time lived experiences of public health issues and solutions across cultural communities in Minnesota. It's produced by HE Consulting and Media, a health communications research and stakeholder engagement agency with a cultural and linguistic lens. Our mission is grounded in building authentic community engagement and partnerships and amplifying communication and health messages that resonate with hard-to-reach communities who often face disparities and difficulties in accessing essential services. In today's episode, we discuss vaccine hesitancy and how to understand and address it in the Somali community in Minnesota in light of recent measles outbreaks. We recorded this episode on September 30th, 2024, and according to Minnesota Department of Health, there has been no new cases since September 29th. First of all, I want to say that vaccine hesitancy is not unique to the Somali community. However, with respect to MMR vaccines, what we refer to as vaccine for measles, mumps, and rubella, it's something that has been of a concern within the Somali community for some time now. Ironically, data shows that before 2004, there was 90% adaptation rate by the Somali community for the MMR vaccine. It has now dropped to 24%. So what happened? In this episode, we will discuss with our panel of leaders and experts some of the influencing factors contributing to this decline and solutions in addressing vaccine hesitancy in the Somali community, as well as the recent measles outbreak that's disproportionately impacting the Somali community in Minnesota. With us today are Lynn Bahta, Immunization Clinical Consultant with the Minnesota Department of Health, Munira Maalimisaq, Family Nurse Practitioner with expertise in diversity, inclusion, and health equity, and the founder and CEO of Inspired Change Clinic. Jamila Abdulkadir, a nurse practitioner at Excel Medical Clinic and co-founder and clinical director at Inspired Change Clinic. Leah Roberts, Public Health Supervisor for Dakota County Public Health. Imam Sharif Mohamed from Dar-Al Mosque in Minneapolis. Thank you for joining us today. So as you know, we are talking about immunizations and vaccinations, and also it's a very relevant topic in light of this recent measles outbreak. So I want to start first by asking you, why are vaccinations important in disease prevention? Why do we want to do vaccinations in the first place?
Yeah, I can answer that. This is Leah from Dakota County Public Health. Hello, thanks for having me. So vaccines are important because they create immunity in our population. So this not only protects the person that's getting the vaccine, so they don't get sick with whatever they're being vaccinated against, but it also is so they can't pass it on to others. So if a lot of people get vaccinated, something we call herd immunity, that leads to diseases no longer being able to circulate in our community, and basically they disappear.
I think we understand that the vaccines we have will protect either ourselves or our children, but when we can stop the infection, we can stop the spread to other people. And because vaccines aren't 100% effective, meaning that sometimes the vaccine doesn't work well on certain people who might have certain kinds of diseases where their immune system, the thing that fights disease, doesn't work well, we can protect those people by not getting sick through vaccination. And so those people really depend on us, whether it's our aunt or our grandmother or a cousin or a best friend who might be getting cancer treatment or some other kind of treatment.
What do you think, Munira?
One thing that I usually tell, hi, my name is Munira. I'm a family nurse practitioner, and I'm also the founder of Inspired Change. One thing that I tell my patients about the importance of vaccines and how they prevent diseases is not everyone has been vaccinated. Some have just one dose, some have 2 doses and not fully vaccinated. And by getting vaccinated, fully vaccinated, you're protecting others that can't, such as infants or people with just weak immune system. So definitely it takes a team and it takes a community, and we kind of have to take care of each other. And it's teaching your body how to read and protect itself in case you ever get that disease.
Leah, I would love to hear your thoughts on this.
So vaccines are like a memory. So basically, you expose your body safely to whatever disease you're vaccinating against, so that the next time that your body encounters that, it remembers how to fight against it. So you're protecting yourself in the future from either getting really sick or getting sick at all, or even dying potentially from that disease. But it creates that memory inside your body.
I wanted to talk a little bit about the vaccine hesitancy and the fear of measles vaccine that has been reported to be the driving force in the decline in MMR vaccines. Before I do that, I want to understand if you can give us a little bit of update, what has been the recent measles outbreak, and where, if you have any update about that. And Lynn, you can, since you're from the state, maybe you can start with that question.
As of Thursday, that's the last time we reported any count. We have seen a total of 59 cases that have occurred since the beginning of the year. But what has been more concerning is since May, we've seen, of those 59, we've seen 51 cases that appear to be related. And in particular, this summer, we have seen some cases that have occurred in settings where there's a lot of kids, and within those settings, also those kids, there's not a lot of children that have been vaccinated. And so that's why we've seen that spread, is because we've got a vulnerable group of people that have not had the vaccine. But we also know that COVID became a time when some of our trust in our government, some of our trust in other big systems like our medical system or the pharmacy system that has made these vaccines has grown. And parents are moving their thoughts about the concern related to COVID vaccine to other vaccines. And this is a very sad situation because, again, as has been discussed, vaccines save lives. And even the COVID vaccine, it saves lives. It may not be the vaccine that stops disease altogether, but for those who can have very serious disease, it, like other vaccines, will protect them from serious disease. And so it's a message that we have to keep giving to our moms, our new moms, that we don't see so many of these diseases anymore. We've forgotten how awful they can be. And we have to keep reminding moms and dads that these can be very dangerous diseases, and they can cause a lot of suffering in our children.
Yeah, I understand. I was just wanted to ask Munira, you see clients, you see families, you serve moms with young kids, and in this recent uptick of measles, I don't know if it's now described as an outbreak, or maybe it is. I'm just wondering if you can talk a little bit about what you are seeing that parents are sharing with you as a concern, but also as a practitioner. What do you think are, I mean, not what do you think, what are the signs and symptoms that are associated with measles, and what are the implications if we do not provide those immunizations to young kids?
I would say a lot of parents are concerned about vaccinating their kids, especially in the Somali community. I think there has been a targeted effort, I believe, in this misinformation, but parents are worried more than autism lately. One thing that I'm noticing is we're getting too many vaccines at a time. My child is not sick. Why am I introducing a new vaccine into their body, and just not understanding or fear of asking for questions, fear of automatically just providers telling them, oh no, it has nothing to do with autism, but they have other questions. And them not feeling like, okay, I'm not even going to ask, I'm just going to say no. So some of them come to me after they've already seen their own provider and say, hey, I still have questions. I heard about the measles outbreak. What can you tell me a little bit more? And I am seeing there is a need for more of an education there and understanding. Yes, the fear of autism is there, but there are several other concerns that parents have. And it's not just in the Somali community, but in all communities, especially after COVID also. But the mistrust in the healthcare systems are making that worse also, and not taking the time to explain it to patients in their language. Signs and symptoms of measles, I would say typically you'll see high fever, temperature of 103 to 105 cough, runny nose, pink eye, sometimes and a rash that is head to toe. But most of them, as you can see, they are similar to regular flu. So a lot of the parents are like, yeah, it's not that big of a deal. But it is big deal, right? Studies show that it can affect the child who gets it, their brain up to 7 to 10 years after getting it. Other risks are or complications are ear infections, infection in the lungs, which is pneumonia, hearing loss, deafness, so many other things. And also, we know that 1 in 3 of 1,000 kids that get it will die from this disease. So not to raise alarms or instill fear, but like knowledge is power and just letting families know, hey, this it's not just a cold, it is more than that. And giving them that tool and letting them make that decisions with you, I think will help in getting them to vaccinate their kids because just the fear and not having all the information is what makes it very hard.
What I have seen the patients having the hesitance of the vaccines are they already know that they don't want to get vaccinated with MMR. I have seen a patient who came from a refugee camp in Kakuma, and when she come to me, she says, "Don't give me the 3 letters vaccine," and she didn't even know what that means. And I asked her where she get the information, and she tells me people told her, "When you go to America, don't take those 3 letter vaccines." So sometimes they already preoccupy their mind with the vaccines their kids want to take or not. We tell them that, okay, let me listen to you. What is your fear first? Explain to me, like Munira was telling us. First, give them a minute. Let them explain to you what the fear is. What your fear is. What do you know about the vaccinations? What they tell you, what their fear is. They let their gut down. They see you as one of them when you're talking to them. And what I learned is explain to them this vaccination. It's an opportunity for your child to get better and get not better, but also get protected from the disease that we worry about for them to have. And I kind of tell them, you don't ask everyone what the vaccines do unless they're expertise on that. So ask the doctors, ask the people who know better than you. And in religion, you're talking about, I know we have an imam who's going to elaborate more. We were pointed out to the Quran that tells us people to seek guidance from others better educated in the topic. So, for instance, if I am a practitioner who's practicing medicine, I know better than the neighbor who's telling you the MMR is bad and it's not connected to the autism or it's not connected to any other problems. It's just protecting you. And back home, a lot of people didn't even have an opportunity to get vaccinated and they used to die for these diseases. So now we have opportunity to protect this for our children. So let's go get vaccinated. And most of them, after you talk to them, they will say, okay, yeah, let's get that vaccinated today. I have vaccinated last week almost like 5 young children on MMR because of that. So what I think is other providers should do is when talking to people, don't shame them what they don't know, educate them, discuss what the vaccinations do for them. So like people will listen when you sit with them and educate them. Like Munira was telling us, if you educate them what the fear is, what the problem is coming from, it's not only the MMR, it's all the vaccinations. If you don't tell them that tetanus is going to protect you from, having tetanus, they're not going to know unless you explain to them. Flu shots are protecting you to have flu. And when I talk to, even back in the days when we talk to our people in Somalia, what did they used to do? I asked one of my elderly, my mother's friend who was elderly, how did you guys do vaccinations back in the days in Somalia when no vaccination exists? What they told me is when they are having when they have goats or camels herding in the rural area, what they used to do is if one of the animals die for a disease, they that animal, what they will do is they will cut a small piece of their lung, and then they will get that and put in their nostrils so they can get immunization from that. So they knew what immunization is. So when I explained to them, this is what our elderly used to do. We were always new vaccinations, but we didn't have opportunity to have this advanced, programs that we can vaccinate ahead of time, protect our people. Then they will listen. So get what their education level is. What do they hear from other people? What is the cost? All of those things I think can help them. And I think with Inspired Change Clinic, what we did with the students, like Munir was discussing with you, is we educated young children who are vibrant, like teenagers, and we're showing them all of these statistics, what the vaccines do for children, mothers, and they going home with that and taking those information and educating their mothers. So as providers or clinicians, what we need is to educate everyone. And it doesn't matter if it's children, young siblings, families. In Somali, people, we're good at word of mouth. So if we talk to while we're in the masjids, while we are in community gatherings, while we are in clinics, everywhere, we're going to start educating, every single one of us starting educating. And I think that will help us more.
Iman Sharif is here with us today as well. I want to read a brief part of his bio to demonstrate how faith intersects with public health and health promotion. He's the co-founder of Hijrah Mosque in Minneapolis and a co-founder of Open Path Resources, working with mainstream organizations to increase the capacity of youth, family, and faith centers in East African and Muslim community. Sharif has led efforts to connect Islamic principles to key mental health and physical health issues common to the community. He is certified as a trainer in mental health first aid and is nationally certified trainer with the Center for Mind-Body Medicine. He was honored with a 2-year fellowship through the University of Chicago School of Medicine to connect with national leaders in healthcare, exploring the Islamic faith's relationship to health outcome. Imam Sharif, welcome to the podcast.
I think several key points I think Jamila mentioned, but I think number one is building the trust between the provider and the parent. I think that's a number one. And when you build the trust between you and the parent, I think the parent listen to you, trusted you a lot. That's one. I think another important point to what I see in the community is a lot of misinformation out there, and how we need to tackle that misinformation too, which is connecting to the vaccine to the autism. If the provider has some kind of nuances, we don't know what cause, could be vaccine, could be that you creating a lot of nuances also. Because when you say that, exactly the parents who already has a lot of misinformation, they say, okay, if you don't know if the vaccine causes the autism, then what you telling me? I think also it's good for the provider to do the clear cut. No correlation between the vaccine and the autism. I think that has to be very clear, concisely. No correlation, no correlation. I think that's also a very good point. I think the third, I think the third point for me is a it is educate the community is part of our responsibility to listen to the expertise. It's not only for we get this information from the Google, we get this information from that, we get this information from that. It is very important for us to educate the parent, the community. It's very important to listen the expertise, which part of the faith also. فَسَأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. If you do not know the subject or the matter, ask the people who know and listen to their guide and listen to their perspective and listen to their. I think also that's very important also for us. But the key point for is we need to build the trust between us, between the providers and the community and the parent. I think that's the key. I want a little bit challenge for the young Somali professionals. Seems to me right now a lot of young Somali professionals is a it's a against of the vaccine, and I think we need also to know where that coming from. It's not only what is against the vaccine. It's not only the people who doesn't know. It is a lot of the young Somali professionals also against of the vaccine too. Where that information come? Where they get this information? Where they get this? It's very important for also to know that and have a very, I think, a open conversation with them. Why all of this one? Because even I think in the last few weeks, I'm seeing some who say, "Oh, I am that. I'm even professional. I am the part of the public health. That. Who also against of the vaccine? How we can tackle that issue? I don't know, because if the person who say I am a professional public health, who say, oh, don't vaccinate your kids, that's not okay. They have a lot of risk. Then we are in a dangerous situation, I think. And also it's good for us, I think, to have a very open debate where that comes from, who they listen to, where they get that information.
I agree with you, Imam Sharif. My name is Munira. I think I know you very well and you know me. But yes, we do have to say autism is not 100% telling families MMR does not cause autism. And then the second question usually is, then what causes autism? And majority of us do not have the answer to that. And we are just like, it doesn't. But studies actually show from CDC that 80% of kids or children that are diagnosed with autism, there is a genetic component to there, and talking about that genetic component. And then they're like, how come we didn't used to get it as much back home? And just being able, like creating a brave space where they can answer those questions. And I think majority of them feel comfortable asking those questions to someone like me at times, because I can go back and forth with them and they feel comfortable there. They see themselves in me. But in places where they can't, where that trust is not there, I think we have to take the initiative in saying, what is your fear? After following up with that, then giving them the answers that they need. But like you said, to 100% say it's not related, and evidence shows that they're not related, and the test, the everything that has been done to prove that, right? Um, and something else that I do agree with you is younger, well-educated practitioners or people that are just educated in general have a lot against vaccinations in general. And I'm noticing and we are from a community of oral learners, right? So someone hears something that carries a lot of weight, and it's harder to educate someone who can talk back and give you data that may or may not even be real. But just meeting them where they're at and showing them the different tests. And I even seen interpreters that thought I was not Somali and would tell a Somali patient to not get vaccinated. This is an interpreter that's um, there to help this family. Just tell them the information that I'm telling them. And she goes, don't get that one. And I knew what she meant. She spoke a different dialogue of Somali that I don't speak, but I understood it. And I was like, no, that's not it. And then having to like go back and re-educate that patient. And once trust is broken like that, how do we repair it? That's something that healthcare providers need to figure out.
When I spoke to a lot of Somali parents they sometimes say we're not against vaccines, but we want to delay vaccines because some of the things that we found parents, in particular Somali families, are see that concern around when children are diagnosed with autism, being close to that MMR age, and wanted to say, hey, we understand the importance of vaccine, but we want to wait and delay. If families are you in the data that you see at the counties or the state at your clinics, are you noticing their their willingness to get their vaccines up to date once the kids are in school age, or are they just not still fearful at that point? And what are the implications if we have a lot of young kids who are not getting their vaccinations at the time that those vaccinations are due?
What we know of this current outbreak is that where we're seeing the most cases are in children under 3 years of age. And so by delaying vaccination, we're not protecting our children. And many of these younger kids are the ones that are ending up in the hospital as well. And so it's not only feeling sick, but also being traumatized by ending up in the hospital. And so that delay comes with a risk, and it's important for parents to understand that you're giving up one risk for a non-existent risk, and meaning that children who have autism, what would be worse is they still get autism because they weren't vaccinated, even though they weren't vaccinated, and now they're going to get measles and have to experience measles with their autistic condition and may end up in the hospital, which can be much more traumatizing. And so that delay really needs to be reconsidered, as much as parents can ask their provider about and talk to their provider about the concerns that they have.
You raised a good question about parents asking and talking to their providers. Lynn, I was wondering, I was working for Ramsey County Public Health, I think the first time that measles outbreak was happening, and it was predominantly impacting the Somali community, and there was some medication around that. And then and then later on, I can't remember the exact, I think it was 2017 or 16, there was another period when there was another similar situation that happened. Now, as of 2024, are you noticing that the issue is not the percentage of kids who are up to date with their immunization is still low in the Somali community compared to other ethnic community? Have you seen improvement in that, or is it still stagnant? And if it's still stagnant, what strategies are in place, or what are strategies that parents and providers and childcare centers and community leaders can do to bridge those gaps? So first part, and second part, you can all address that, but that data, I'm wondering if you can share any data update for the listeners. I think it used to be 34%, and we need about 80% to achieve that herd immunity. Has that improved over time, and how can we improve that? What new things can we do that we haven't done so far? Because I know there's been outreach and education and different things that have occurred over time.
Good questions. Our rates among our Somali ethnic children have dropped down to 25% statewide. So very devastating numbers for us. And a lot of that is due to COVID adding to the difficulty getting into the doctor to even have those discussions. And not only did we see a downturn in the MMR rates, but among our Somali ethnic children, but also among all Minnesota children. And so some of the things that we've been trying to do is actually working with a group of healthcare providers to think about different types of projects that can be done both within the clinic and at a state level. Things like sending out postcards to remind parents to set up appointments. We did, after the 2017 outbreak, we did work with faith communities to try to pair them with a healthcare professional. That seemed to work really well in the outbreak, but it was very hard to keep people interested in these activities once the outbreak is done. And so this has been a challenge. Right now, we have a couple state contracts with local community-based organizations and are trying to tap into their fresh minds and their perspectives as members of the community to see if there are some things that we can do that we haven't done before. And we're hoping one of the things that will come out of this would be short, simple messages by community members and some of the known healthcare providers in the community through TikTok messages or Snapchat, those type of social media messages where that can be shared back and forth and links can be for reliable information can be sent on as well. So I welcome new, fresh ideas and ways that we can sustain interest both in the community and among our providers beyond an outbreak, because this will keep happening if our levels just don't go back up. And really for measles, we want to see them above 90%. And right now in Minnesota, we're not even there in the broad base. So we really do need work. We have work to do.
Lynn, I completely agree with you on that, on different ways to teach our community and empower them so that we can lead with their voices. But first, we have to listen to their fears and go from there. Something that we did at Inspire Change recently was gather our 34 students that we have in our fellowship, teach them about the vaccines and why, especially MMR vaccine, is important. And then have them go out into the community and educate the community members. So it's almost peer-to-peer education. One thing that we know in the Somali communities, a lot of us will bring their teenagers to come and be an interpreter and help. So the more we are reaching out to the young people, I've noticed it has helped in educating parents and parents coming to the clinic a little bit more informed. This was the one thing that I was so proud of, because about a week ago, I had a patient come in, had a young child who's 3 years old, and said, "Hey, I want to vaccinate my kid because I heard from this and this, these teenagers about the importance of vaccinating." And I was just sitting there going, "I know those teenagers." Just the importance of the community taking power and letting them do the work, while us as healthcare providers are giving them the tools. Just has been one of the best things that I've seen. But yes, we have to try different ways in educating them because the fear is real. I also had a younger lady who was really educated, and I started talking to her about MMR and why it was important. And she goes, "Hold on 1 second," and gave me data that I did not even expect. She said, back in 2010, 1 in 32 kids, Somali kids, were being diagnosed with autism, and now in 2020, it's 1 in 16. So she goes, "No, this is too much. It has to be connected to MMR." And very, very intelligent in how she's putting her words. But at the end, we were able to come to an understanding that she was going to go ahead and vaccinate her child, and said, I'm going to do one dose and I'm not going to do the second one till he's a lot older. And I was like, okay, one dose is 93% effective. We'll go with that.
Yes, and we have seen some rise in the incidence of autism through the surveys that have been done. And yet, despite the rise, we've been seeing a very low MMR rate. So the two aren't connected. If we were seeing autism rates drop along with MMR rates, we might maybe be suspicious, but they're going the opposite direction, which shows that there is no connection between the two.
Yes, yes, absolutely.
I am curious, Leah, you are at the Dakota County side, and there are a lot of Somalis that also live in Dakota County, Burnsville, Apple Valley, Egan. You also work with, as a public health system, you're also serving communities, the Latino communities, the other communities. What are some of the vaccine hesitancy that you hear from other communities? And how low is vaccine compliance in MMR compliance when we compare to other populations outside of the Somali community?
Great question. So I don't have the numbers right in front of me, but I can tell you that vaccine compliance is down across the board. There's definitely, obviously, like Lynn said, with the Somali community, especially with MMR, there is definitely a higher degree of lack of compliance. However, we do see it really across the board right now. And it's hard to say. It could be for a variety of reasons. Vaccine hesitancy is very real. I loved what Munira said about, it's important to also acknowledge fears. And at the end of the day, people are scared, right? And they want to do what's best for their kids. So I think it's important that we give them the good information. That vaccines do not cause autism, vaccines protect. But again, there is that fear there. Another factor that we've seen a lot of is just during the pandemic, schools stopped pulling kids out of school for vaccine compliance just due to a variety of things. They've started to do that now, but a lot of kids are super behind on their school required vaccines. MMR being one. So MMR is given at age 1, and then going into kindergarten, you do need 2 doses of MMR to go to school. And a lot of kids are behind on that, as well as other school required vaccines. And a lot are getting caught up right now, and some more slowly than others.
What about daycares? Are they in compliance? Is there any incentive or any policy that can ensure daycares, kids who are going to daycares, are getting their immunizations up to date across the state?
Yes, so there are required vaccines for like a daycare center or an early childhood program through, say, a school district. But if kids are going to, for example, an in-home childcare or a family friend neighbor kind of childcare provider, there are no required vaccines. Obviously recommended, but there is no compliance requirement, or they couldn't be pulled from the program.
I want to ask all of you if you can talk a little bit about, I've noticed, especially in the MMR vaccine outbreaks, sometimes you hear there's a family that travel back to Africa. There's not a high level of compliance over there. They come back, the kids develops measles, they're going to Quran school or they're going to daycare or school, and then it kind of goes from there. Are there strategies in place to help kind of talk to those parents before they even leave the country, like encourage them to get their vaccines up to date? Are there things in place to help community clinics to have health advocates to help families to kind of offer them opportunity, or like do a big campaign so that all the entry points where families are taking their kids, or where families get their trusted messengers, like we're going from all angles? And I'm just curious to hear your input from what you have seen as sort of trigger, or the thing that starts this whole thing. I think there's a connection to traveling, and I'm just curious if you can if we know ahead of time, what are some things that we can do to minimize or mitigate those kind of risks?
I think that's a great question. I think it starts with our primary care providers in making plans with families. We know that a lot of these families tend to travel around the summertime. So one thing that I do is just try to bring that up, say, hey, do you guys have any big plans coming up? And if it's the answer is yes, just providing the education right there and then, even if it's a couple months away, and saying, okay, is there any way to delay it by 2 months if the child is 8 months old or 12 months, just about to be 12 months, and then get them their vaccines and then go. And how that will protect that child, and not just that child, but others also, and making this being an effort where we all come together and for the greater good. And in our religion, and the Imam is going to talk about it later, I'm pretty sure, but we have to protect each other. And sometimes bringing that up is very helpful in getting parents to listen and to go, okay, I'm going to delay it for a month. I will come back next month, get my child vaccinated. But different strategies depending on how well you know your patients, and just taking that time to listen and ask those questions. And as you know, many of us are on time crunch. When you have 20 minutes to see a patient for a well child, there's only so much that you can spend on vaccines also, but this is a very important cause to talk about and increase health literacy around.
These are great points. I want to pivot to discussing the access part, where families can access vaccines when they need them. Leah, could you talk about that?
Yeah, no, absolutely. So we, of course, if families have insurance, we always recommend they go to their primary care provider for vaccines so they can get a more complete checkup. However, if they don't have insurance, or they don't have insurance that covers vaccines, there are options to get vaccinated. So depending on which county you live in, but if you live in Minnesota, there's the Minnesota Vaccines for Children program. So that vaccinates uninsured or underinsured children, or children who are American Indian or Alaska Native. Depending on which county you live in, most public health departments, especially here in the metro area, will offer that program. As well as also vaccines for adults. So uninsured or underinsured adults, they can also offer vaccine there, and MMR is always carried, as well as other standard scheduled vaccines for children and adults. If you live in Dakota County, we do have appointment clinics, including evenings, as well as we do offer a mobile clinic in the summer months, May through September, where we travel all around the county and offer walk-in immunizations. You can visit our website and search vaccines if you're looking for any vaccine clinics near you, or call us at 952-891-7999, which is our vaccine information line. And we do take messages in English, Spanish, and Somali.
Sounds good. Thank you. Munira and Jamila, do you have any resources that you want to highlight with regards to accessibility, even if families don't have insurance?
Yes, if they go to www.inspirechange.com or .org, they can get information on vaccines. And we do have vaccine outreach on once a month. I believe it's Thursdays. I'll have to double check.
How about you, Jamila? Do you have any information related to access or outreach, or something that you want to highlight in your clinic?
Yes, and Inspire Change is number one, but also an access clinic. They do give vaccines, I believe. I have seen it's a community clinic, so people come in and they can get vaccinated.
Thank you, everyone, for joining the conversation. I would say that when we worked on the autism way back, and even the findings came out, the immunization was, better than where it's standing today. So there's definitely some forces that have echoed those against vaccine messages, and it makes, I think, the outreach and education even harder. It's got harder than it was. I think that was something that really came through today's conversation. It's even harder than where we were in those conversations early on, even when we were presenting the 1 in 34 data for the prevalence study. And I think maybe some of the COVID didn't make it easy. I think that was another thing that I've maybe this is adding to the delay as well. I'm hoping we can come back to this conversation in some time to revisit and see, how are we doing? I think it's one of those topics that need to be revisited because so much work needs to be done. And I would like to have you back in near future so we can say, well, where do we go from here? Like, what should we be doing? What can we do more? Because if these numbers and vaccination compliances are going lower, then I don't think we are protected from this outbreak or future outbreak. And not only the MRI, but in vaccination in general, there's just definitely seems to be an uphill battle. So I appreciate your time, and I definitely think we should come back together for this topic.
Policy Connecting Communities is produced by AG Consulting and Media. The Policy Connecting Communities podcast, produced by AG Consulting and Media, highlights the public health efforts and strategies used to empower and grow community and policy development. This program is being supported in part by the federal award number S01ep02, awarded to Washington County by the U.S. Department of the Treasury. The Washington County Public Health and Environment Department provides low-cost vaccines to eligible infants, children, and adults who live in Washington County. Immunization clinics are offered monthly at the Stillwater Government Center, Forest Lake Service Center, and Cottage Grove Service Center. Visit washingtoncountymn.gov/immunizations or call 651-430-4036 to schedule an appointment. Interpreter services are available.